if you are a true operator and you remove yourself from a dental practice, just like if you are the owner of McDonald's and you are no longer frying the hamburgers, you're removing yourself as a technician from the dental office, you now become a true business owner. Okay, so you put an associate in your practice or a number of associates in your practice to generate the income for the practice without you, and then you have 10% of the gross or of the net of the dental practice. That is what I would call a true business. I'm not encouraging anybody to quit clinical dentistry, but what I would say is that you don't have a real business if the business does not run without you there. Okay? Clinical dentistry is best, and I'm telling you this as a 22-year veteran of clinical dentistry, clinical dentistry is much more fun and rewarding if you're doing it by choice, right? So if you can structure your business in a way that it's a real business and you are not necessary in the dental practice, and you can step away and you can take care of an ailing parent like I had to do for 6 weeks, or go on 5 mission trips a year, and the business does not hiccup or stop generating revenue, that's a real business. If you decide that you have to take care of your dying parent or want to do better for the world, and you go on a mission trip and all revenue stops with the exception of maybe 1 or 2 or 3 hygienists, that is not a real business. That's not sustainable. Okay, so what we try to do is get people in a position that they're creating real businesses, and that means that the old-fashioned lifestyle practice with 1 doctor, 1 front desk, 1 clinical assistant, and 1 hygienist, which is super profitable and super lean, that, in my opinion, is not a lifestyle practice. That's what we used to call a lifestyle practice. That is not a lifestyle practice. My new definition of a lifestyle practice is making sure that you have some redundancy. If that front desk person, like I talked about before, decides that she no longer wants to work for you because corporate is giving her $7 more per hour, and she takes all of her knowledge and her systems with her in her brain, then you're screwed. That's a huge point of vulnerability. One way to structure your organization around that is to have systems download her brain, get those systems somewhere that are reproducible and retrainable. That's one way to decrease vulnerability. But really the true way to decrease vulnerability is to multiply the number of people that you have per position, particularly for the providers.